All right, so private health insurance, right?
Mm-hmm.
That's our target market. In my humble opinion, the best two plans on the marketplace for private health insurance, one is Manhattan Life, right, which you kind of have gotten a little bit familiar with at this point. The other one is going to be LifeX. Okay. Now, pros and cons to each. Manhattan Life's going to win on money. It's going to be more affordable.
Yeah.
Okay. I also think it wins on value. So for what you're paying, you're getting more, right?
Yeah.
LifeX is going to win on, let's call it readability. Readability, okay? In other words, this is more confusing for prospects to understand.
Yeah.
Right? This works the exact opposite of traditional health insurance, where you have the benefits first, and it's no deductible, right? But you have the benefits first, and then whatever's left over is the policyholder's cost, right?
Okay.
In other words, if the policy covers, $175 for a doctor's visit, you basically walk into the doctor's visit with that money in your pocket.
Got it.
Okay. If the doctor charges $100, you made 75. Okay. You came out ahead. If the doctor charges 200, then you're negative 25. You're paying 25, right?
Yep.
So that's how that plan works for everything: hospitals, surgeries, doctors, diagnostics, prescriptions, everything. Okay. LifeX has a much easier readability. It's more traditional. Okay. Your deductible is $1,500. You have co-pays for your doctor's visits and drugs. Your max out of pocket is going to be, $9,200, right?
Yeah.
ACA compliant, not ACA compliant. Okay. So who buys what? First of all, both customers have to be healthy. Okay.
Yeah.
Customers that are conscious about what they're spending on insurance, right? Just want something that is affordable and they have a lot of value in it, are probably going to buy Manhattan Life. Assuming that I do a good job explaining it to them, they can understand how it works.
Yeah.
Because the benefit levels for everything are more than enough if you're committed to being a consumer of health insurance or health care, right?
Yeah.
In other words, you're not going to be a victim, right? How do we make sure that you're a consumer as opposed to a victim? Advocacy, right? We know the cost of care going in. That's important.
Yeah.
People that are going to buy LifeX are going to be people that can afford it, right? Are more concerned with catastrophic and having, just a policy that they understand, right? Deductible and copays, right? And they don't care what it costs. They don't want to shop for anything. They want to know that when they go in to the doctor, they're paying a $40 copay, right?
Yeah.
They don't care that if they go into the doctor, they could pocket $40 or $75, right? If they knew the cost and did a little research and found out who charges what, they just want to go in and know that the doctor's in network and they charge they get a $40 out-of-pocket cost, right?
Mm-hmm.
So I like to call this, I refer to this as the Bentley of health insurance, right? It's the best. It's the best plan on the market, okay? In terms of coverage, in terms of, again, readability and understanding the policy and how it works. It's more traditional, right? Customers get it. This one I like to call the Mercedes-Benz of the health insurance, right?
Yeah.
It's more affordable, but still has a ton of value,
Yeah.
right? So those are the top two private health insurance plans on the market. And then there's a lot that come in, if they're sitting up here, at the top, there's a lot that come in right here, right? Like Philadelphia American, right? Who used to be in this spot, in my opinion. Iron Health, which is, kind of similar to LifeX. Allstate, which recently sold to Nationwide. So they're going to be rebranded next month as Nationwide. Nationwide will have health insurance now. United Healthcare, right? These private plans all come in, not a distant second, but definitely in second place to these two policies, okay, these two carriers. And so that's why when we go in with private options, we start with something that's affordable, that has a lot of value.
Yeah.
And we'll give the option to, if they're having a hard time understanding it or they want more coverage, cool, we have that option, right?
Yeah.
When would we come here? Maybe somebody's had, maybe they can't afford this, but they've, got a bad taste in their mouth with this because they've had experience with it and they just don't like it. Okay, well, maybe Iron Health or Nationwide or UHC, right, is more, suited for their palate, right? Some people just want to buy a brand name, right? United Healthcare.
Yeah.
I want a brand name. Even though I've sat on phone calls with United Healthcare brass, and they tell me all the time how these off brands like Philadelphia American and Manhattan Life are a thorn in their ass because they beat them. They beat them on price and they beat them on benefits, right? So, but there's gonna be people out there that just want a brand name on their insurance card, right? So, and the other thing with LifeX is you do get a brand name on your insurance card because it's part of the Cigna EPO network. And so a lot of times you get that card, it's going to have the Cigna logo on it, right? So there's a lot of brand power with LifeX, but at the end of the day, Manhattan Life, again, in my humble opinion, still the best value for the price that you're paying. Make sense?
Yeah.
Okay. So when we call prospects, and I shut that off already, when we call prospects, I'm going to go in with these two options, right? Mostly this one to start.
Yeah.
Because again, the hook is the price.
Yeah, it looks
right?
good.
We want them to like the price. We want them to like the deductible. And so you kind of know the tickles, right?
Yeah.
So